Hello, my name is Amy Lucero, and I'm a student of social work at National University. And I will be presenting a training on how to work with children who have experienced abuse and neglect. Training objective: to bring awareness, identification, intervention, and resources. Child abuse and neglect is a preventable issue, and its impact on a child's development is significant. Therefore, training is crucial in equipping social workers with the necessary skills to assess, intervene, and advocate for vulnerable children. Defining child maltreatment. There are four types of child maltreatment: that's physical, sexual, emotional, and neglect. CAPTA refers to Child Abuse Prevention and Treatment Act. According to the World Health Organization, physical, emotional, and sexual abuse, as well as neglect and exploitation, jeopardize a child's health, development, and dignity within a relationship of responsibility, trust, or power. Child abuse and neglect is a significant social concern. Children who experience abuse and neglect are more likely to have development delays and impaired language or cognitive skills, or even be identified as a problem child. Problem children often have attention difficulties and challenging behaviors that later flag them for criminal or violent behaviors. These abused or neglected children often experience depression, anxiety, or other mental health disorders as adults, and even engage in health risking behaviors as adults, which lead to poor health outcomes as adults. Types of abuse: physical, sexual, emotional, neglect, and medical abuse. Physical child abuse occurs when a child is purposely physically injured or put at risk of harm by another person. Child abuse is any sexual activity with a child. This can involve sexual contact, such as intentional sexual touching, oral, genital contact, or intercourse. This can also involve no contact sexual abuse of a child, such as exposing a child to sexual activity or pornography. For example, observing or filming a child in sexual manner, sexual harassment of a child, and prostitution of a child, including sex trafficking. Emotional child abuse means injuring a child's self esteem or emotional well being. This includes verbal and emotional assault, such as continually belittling or berating a child, as well as isolating and ignoring or even rejecting a child. Child neglect is failure to provide adequate food, clothing, shelter, clean living conditions, affection, supervision, education, or even dental and medical care. And then there's medical child abuse, which occurs when someone gives false information about illness in a child that requires medical attention and putting the child at risk of injury and unnecessary medical care. Recognizing the signs of maltreatment. According to the U.S. Department of Health and Human Services, it states that as young maltreated children mature, they begin to experience problems in school and are less inclined to engage in academic exploration and require external motivation before they are also before they are they also exhibit poor work habits and receive lower grades in math and English during the elementary years. Common problems seen in maltreated children younger than the age of 3 include poor emotional comprehension, heightened arousal to negative emotions, increased expression of negative emotion, and increased evidence of insecure attachment to relationships, and poor peer relations and social competence. According to the U.S. Department of Health and Human Services, it states that health growth, motor delays, and psychological systems expect developmental problems during adult years for maltreated children younger than the ages of 3 years. 22 to 82% demonstrated acute and chronic health problems, and 11% demonstrated failure to thrive. 20% demonstrated growth delays, and 4 to 44% demonstrated gross and fine motor delays. Barriers to disclosure: there's fear, loyalty, shame, and manipulation by the abuser. Disclosure is commonly defined as survivors revealing, telling, and or making a statement or report. Disclosures could either be formal or informal. The former type of disclosure involves disclosure to authorities, whereas the latter involves disclosure to non authority figures such as family members, peers, or friends. Shame and fear keep children from telling on someone with sometimes including cultural factors, reinforcing such feelings. And many children comply with the abuser's demand for silence because of secrecy pacts, violence, and threats. Loyalty and manipulation by the abuser is usually seen when victims usually love the perpetrator. They consider them as a mother or a father figure because they have been living with them for a long time. Therefore, they don't acknowledge that the conduct they've been subjected to constitutes abuse. The children think of the abuse as an expression of love. Specific issues in working with this population include trauma impact, trust issues, developmental delays, and complex family dynamics. Individuals exposed to ACEs or ACEs and polyvictimization undergo significant shifts in their developmental trajectories. These experiences tend to threaten core beliefs and assumptions, including their self esteem as well as their sense of lovability, vulnerability, and faith in family and friendships. Children with trauma live in persistent states of fear and terror, and recurring traumas become transformative developmental delays. This heightened fear propensity disrupts self awareness, information processing, and interpersonal communication, and age appropriate developmental competencies for establishing healthy relationship parameters, identifying and expressing feelings, and uh, expressing feelings appropriately, and tolerating ambiguity, and causing individuals to have problems learning, making friends at school, and appreciating their strengths and unique abilities, which are often overshadowed by their social and behavioral difficulties. Evidence informed crisis counseling techniques include safety first, active listening, grounding techniques, and psychoeducation. So, evidence informed crisis counseling is a method of providing support during a crisis that is guided by research and best practices rather than relying solely on intuition or tradition. Robert's 7 stages of crisis intervention model include plan and conduct a thorough biopsychosocial and imminent danger assessment. At minimum, the assessment should cover the client's environmental supports and stressor, medical needs and medications, any current use of drugs and alcohol, and internal and external coping methods and resources. making a psychological contact and rapidly establish the relationship. Rapport is facilitated by a counselor in the form of building trust and confidence with the client, identifying the major problems, including crisis participants, focusing on the client's current problems, which are often the ones have participated that have precipitated the crisis, therefore finding out what has led the client to require help at the present time, encourage an exploration of feelings and emotions. The crisis worker will strive to allow the client to express feelings and to explain their story about the current crisis situation. To do this, the crisis worker uses active listening skills such as paraphrasing, reflective listening, and motivational interviewing. Generate and explore alertiveness. Alternatives. Sorry. This is when the client and the counselor may explore options such as housing, chemical dependency programs, or mental health resources. Restore functioning through the implementation of an action plan. At this stage, explore options to become an options become an action plan for a treatment plan. Follow the follow up. The follow up with the client should be to evaluate the status of the client post crisis, which may include nutrition, hygiene, and sleeping, in addition to the resource follow up. Okay, trauma informed care principles include safety, trustworthiness, empowerment, cultural humility. Trauma informed care realizes that the impact of trauma and understands potential paths for recovery, recognizing the signs and symptoms of trauma in clients and families, staff, and others involved with the system, and responds by fully integrating knowledge about trauma into policies, procedures, and practices, and seeks to actively resist re traumatization. SAMHSA trauma informed framework states safety in physical settings and interpersonal interactions, trustworthiness, and transparency. Operations are conducted and decisions are made with transparency, consistency, respect, and fairness so as to build and maintain trust. Empowerment. Individuals' strengths and experiences are recognized and built upon, and cultural humility. Organization moves beyond the cultural stereotypes and biases. Treatment options. Trauma focused CBT helps children cope with trauma related distress through the use of healthy coping skills, helps children to process their traumatic experiences, assists non offending caregivers in responding supportively to children's distress, and help them cope with their own feelings related to the trauma, improves communication between caregivers and children, reduces children's behavioral and emotional difficulties, and enhances future safety in order to reduce risk of re-victimization. Play therapy. Sometimes a child's feelings extend beyond what they can explain through words. Using toys, play therapists can build on the natural way children learn about themselves and those around them. This also allows children to express their feelings and thoughts in a way that is aligned with their social, emotional, and cognitive developmental stage. EMDR is a form of psychotherapy used for treating PTSD. Clients with typical recount memories of a traumatic event while engaging in physical stimulation use rapid eye movement as a stimulation, in which the therapist directs the patient to quickly move their eyes from side to side. Other stimulations can also be used, such as alternately tapping the client's legs or shoulders using specialized lights that flash in alternate sequence, or handheld devices that alternately vibrate. Family therapy-based therapy interventions are one of many frontline services provided to families at high risk of physical abuse and neglect. Family based therapy is broad in definition, with the main distinction from individual based therapy being that it treats the family unit as a system, which may include parents, extended family, and children. In protection, family based therapy involves psychologists or social workers who engage with family members to modify home environments, behaviors, and interaction patterns of parents and children with the goal of reducing physical abuse and or neglect so children can safely remain or reunify with their family. Multidisciplinary collaboration includes CPS, law enforcement, medical professionals, and educators. MDTs, or multidisciplinary teams, bring together professionals from different disciplines such as law enforcement, child protective services, prosecution, medical professionals, mental health professionals, and victim advocacy to work together on cases of child abuse and neglect. Local resources from the Los Angeles County area include DCFS, Northridge Hospital Medical Center Trauma Program, the Children's Bureau of Southern California, and 211 LA. And of course, there's also 911. If there is any suspicion of maltreatment, abuse, or neglect, it is always important to contact your local authorities. Self-care for social workers. Social workers have a complex role of providing social services with compassion and empathy while working tirelessly, enduring burnout at some level in their careers. The consequences of burnout can be harmful to workers, the people who they serve, and their families and careers. So it's important to take time out for self reflection, exercise, setting limits, and maintaining boundaries, making sure you're eating, drinking, and sleeping well, taking time off, and talking to somebody. These are my references, and thank you.